Hi, my name is Dr. Keith Javery with the Javery Pain Institute. Some of you may have had recommendations to undergo a procedure, what we term radiofrequency ablation. We call it RF for short, standing for radiofrequency and then ablation. What is RF? RF is the use of radio wave energy to turn off or to stun specific pain nerves so that they don't send their pain signals for a much longer period of time as compared to a traditional nerve block where we'll inject numbing medication or Novocaine-like medications, lidocaine, bupivacaine, and those types of medications will turn off nerves for a period of hours or days, and additional medicines are used to maybe settle down pain for weeks or even months. But if RFA is required, or if you are a candidate for RFA, many of you need to know what it is. For those of you who have pain of or from your facet joints, may have received median branch blocks or facet injections. Those are where we take very small needles and I place them under X-ray guidance to the very specific small nerves or the joints of the facet joints. These are small joints that are at every level of our spine, whether it be your neck, your mid-back, or your low back. The facet joint is the joint that if it's producing pain, it will cause nagging, low back pain, or neck pain, or mid-back pain. But the key is to identify exactly which joints are causing the pain and then to settle down the pain as long as possible if standard, traditional, conservative measures don't help you. If those of you who have had median facet injections or medial branch blocks or standard facet injections are recommended to consider RFA or radiofrequency ablation, we would first have to perform a standard medial branch block. Those of my patients or other patients are familiar with that, and that's where we use a very small needle. It's a 22 gauge needle in most cases. So small, it's hard for me to even focus on it, but the majority of this needle doesn't have to be inserted in. This needle is used to be placed under X-ray guidance precisely to the median nerve in question. This nerve receives and sends pain information from that particular facet joint. If you get excellent pain relief from your regular facet medial branch blocks, and if that relief is very good to excellent and consistent with the type of anesthetic that we use that day, whether your relief lasts the hours or may last longer, but if you get excellent relief for the time that is appropriate, then you will probably be offered a radiofrequency ablation, because we want to have your pain controlled for as long a period as time in between any potential needed interventions. RFA is the treatment of choice for any spinal pain that has been proven to be responsive to medial branch blocks. With this little needle, we are able to specifically block facet joints under X-ray guidance, and you will determine and tell your pain doctor if you got the relief that we're looking for, even if it's temporary relief, especially if it's temporary relief. But if it's excellent but temporary relief, then we know that we have identified the facet joint or the facet joints that are responsible for your spinal pain. If that is proven, then we can consider the use of radiofrequency ablation. Many of you hear this and may wonder, what is that? That's when we utilize needles placed to the exact same spots of where we've placed the medial branch blocks for your regular facet injections. A needle is placed to the same exact spot in the same exact way that the test injections were done. There's only one difference. This needle is used. It's a little bit bigger, but it's no difference in its size or length, except for it's just a little bit bigger in what we call gauge. Most common, we'll use an 18 gauge. Most common regular facet injections will use 22 gauge. But we will numb you up and, if needed, give you any extra sedation if it's medically required to make sure that you're comfortable during the entire procedure. The RF procedure is only one extra step. And I'll illustrate that. In the regular facet injection, this needle is introduced to the specific median branches or the specific nerves of the facet joint or joints that we suspect to be causing your pain. In the RF, this needle is inserted to the exact same spot that we have previously identified with this needle. With the RF, we then inject a local anesthetic. Just like we inject a local anesthetic with the medial branch block, we inject a local anesthetic with the RF needle so that we numb up the nerve before we do anything else. The same way we numbed up the nerve with the test injections or the previous facet injections. So far, the same procedure, except slightly different needles. The next step is different with RF. Instead of just injecting the medicine and then taking out the needle and we're done, like we do with the regular facet injections, we inject the medicine to the nerve to anesthetize it and to numb it. But before we pull it out, we have just one extra step to do, and that's the main difference, and frankly, the only major difference between the regular facet injection and the RFA. Before we pull out this needle, we then insert a small little tiny wire, it's called a probe, a radiofrequency probe, into this inside of this special needle, and then it's connected to a computer, and that computer will deliver 90 seconds typically, 90 seconds of radio frequency energy. What this energy will do is it will stun and it will turn off that nerve's ability to send pain signals anymore from that facet joint. It doesn't last forever, but the average patient enjoys 6 months of reduced pain with radio frequency ablation versus maybe just hours or days or weeks or even a few months of relief with regular facet injections. So hours to days worth of relief versus 6 or more months of relief in the majority of patients that respond to regular median facet injections. All of my patients and all patients at Javery Pain Institute are of course given educational materials and information as to any treatment that we proposed, whether it be medicinal, physical therapy, exercises, other modalities, or interventions. No different. The risks of this regular procedure of the facet injections, whether they be test injections or whether you use to receive this for treatment of your facet spinal pain, has no significant differences in risk when it comes to this. The bottom line is that the major difference is in the size of the needle, and if everything goes well, which thankfully it does the vast majority of times, the major difference is days or hours, days or weeks, perhaps even a few months of relief, versus when this works, 6 months and longer relief in the vast majority of patients.